Assalamu alaikum. Hope you are well. My name is Arush. Me and my group fellows Bushra, Misha and Isha from the pharmacy department of UCP are going to discuss the drug salbutamol. These are the contents that we have to discuss: origin and history, chemistry, pharmacology, toxicology, available dosage form, clinical uses, brand names of salbutamol. Let's talk about origin and history. Salbutamol was discovered in 1966, but it was launched as Ventolin and Proventil in 1969 officially. In past, injected epinephrine was used for the treatment of asthma, but it comes with adverse side effects. To avoid these side effects, the researchers had to search the adrenaline analogue that would retain the bronchodilating quality without the cardiovascular side effects. So that made the discovery of salbutamol. Chemistry of salbutamol. Molecular formula of salbutamol is C13H21NO3. It is also known as albuterol and it is a member of class of phenylethanolamine. It has the secondary amino group. Here is the chemical structure of salbutamol. Pharmacology of salbutamol. As we all know that in pharmacology we discussed about the pharmacokinetics and pharmacodynamics of the drug. Pharmacokinetics of salbutamol. In pharmacokinetics, we discussed about the absorption, distribution, metabolism and elimination of the drug. Absorption of salbutamol. Salbutamol is given through the nasal route, but it can be given through the oral route. Absorption is rapid when given through the nasal route and it also gives the less systemic effects. Salbutamol is a short-acting drug. Onset of action of the salbutamol is 2 to 3 minutes and it has the duration of action of 2 to 4 hours when given through the nasal route. Distribution of salbutamol. Salbutamol can be distributed throughout the body because it can cross the blood-brain barrier. Metabolism and elimination. Metabolism of salbutamol. Salbutamol is non-catecholic drug, so it does not act by COMT, catechol or methyl transferase enzyme. It is metabolized into the albuterol sulfate and it can't destroy by GIT mucosa also. Elimination of salbutamol. Salbutamol is eliminated in urine, but it can be eliminated through the rectal route when given orally. Pharmacodynamics of salbutamol. Mechanism of action. It is directly acting drug on beta-2 receptors, although it is selective beta-2 agonist but have a little bit effect on beta-1 receptors also. When salbutamol attaches on beta-2 receptors of bronchial smooth muscles, it activates the adenylate cyclase. By the activation of adenylate cyclase, CAMP amount increases. Increased CAMP inhibits the myosin light chain kinase enzyme and it inhibits the myosin phosphorylation. And at the end smooth muscles relax. Pharmacological actions of salbutamol. Salbutamol causes the bronchial smooth muscle dilation. It decreases the tone and motility in GIT. It also acts on beta-2 receptors of blood vessels and causes the dilation. It also relaxes the detrusor muscles. Adverse effects of salbutamol. Headache, throat irritation, bronchitis, cough, musculoskeletal pain, dry mouth, chest pain, rapid heart rate, tremor, upper respiratory inflammation also. Toxicology of salbutamol. Salbutamol toxicity results in tremor and tachycardia. Tremor is the shivering of muscles and tachycardia is the increased heart rate. How to cope up with the toxicity? Propranolol and butoxamine are used to treat the toxicity of salbutamol, but propranolol is used clinically because it is non-selective beta antagonist. It normalizes the heart rate as well as decreases the beta-2 receptors activity. Let's talk about some available dosage forms of salbutamol such as tablets, prolonged release capsules and tablets, salbutamol nebulizer solution, powder for inhalation, pressurized inhalations as well as oral solutions. Clinical uses of salbutamol. Although salbutamol has many pharmacological actions, but it is used clinically for asthma, chronic obstructive pulmonary disease (COPD). It is also used in acute asthmatic bronchospasm. These are some brand names of salbutamol such as Proventil, Ventolin, ProAir HFA and Acunab. Here are some references.